Hey, there we go. We are live on the air. Show-Me Streamcast down here in the undeclared capital of Central Missouri, St. Robert, Missouri. And we've got a special guest for you today. But first and foremost, as always, I want to give a shout-out to Prue and Prue Law Office and Mark C. Prue in the office down there in Waynesville, Missouri. They're a gold sponsor, and they keep the lights on, keep us chiming around. If you see or are listening right now and you can't hear us, if you can't hear us, please let me know. But I think I got all the kinks worked out. Everything looks good. So, with that, who do we have in the office? Go ahead and introduce yourself.
My name is Marissa Spencer.
Put a little bit closer. I'm going to...
Thank you. My name is Marissa Spencer. I'm a licensed massage therapist located in Waynesville, Missouri.
Awesome. We're here to talk a little bit about massage therapy, clinical therapy, and what you provide for the service. It just occurred to me, I get on my health care through the VA, and a lot of this is community care. Have you sought out or do you provide services on behalf of the VA yet?
I have in the past.
Right.
But I haven't here because I'm a one-woman show.
Gotcha.
So I don't have the availability to take on all the veterans that are in this.
Oh, I can imagine because there's nobody that does it. It's just like massage therapy or nothing like that for the VA. And this pain medication in my case. So let me make sure everything's working good. And I can see speakers moving. Let me turn it up a little bit. I think I got music going. We don't want that. Test. Yeah, there we go. Okay, we got lines moving, so that's a good thing. So give myself a round of applause.
All right.
There we go. It didn't work that good. Now, what's your philosophy behind your approach to manual and therapy and pain management? What would you consider your philosophy? Well, let me go back first. How'd you get this started? This is a big leap being a business owner. Mm-hmm. Who's in it with you? Who's taking the dive?
Well, primarily myself.
Right.
Also my husband. He's kind of taken a step back because we have 6 boys at
Good
home.
googly moogly.
So he definitely is the one taking care of them primarily.
Right. So you're and I see we'll talk a little bit about apprenticeship opportunities that you're offering.
Yes.
Well, we'll talk a little bit about that on the outside. Now, where are you located at physically?
So we're right off of exit 150.
Right.
It's the Lakeway exit, but we are in Waynesville, just the very outskirts.
I better turn your mic up now. That's better.
Okay.
I told you I'm slacking because I'm waiting for the wife to tell me I can't hear her. Now we can hear you. I had it turned on here, so.
Okay.
So say that again for me so they hear it again.
So I'm located in the outskirts of Waynesville.
Right.
It's right off of exit 150. It's the Lakeway exit.
Okay.
And you can see my space from the highway.
Oh, really?
Yeah.
Oh, that's incredible. Now, I got some pictures here, and we'll bring them up here in a little bit, but I don't have inside the building. Maybe you can share with us later at another time, their office, and I'll come by, maybe record some video of the benefits. Now, how long have you been in business?
About 2.5 years now.
2.5 years, and I checked for appointments, and there are none, so I'm assuming it's going rather well.
Yeah, it's been going pretty well. I do have a fully built clientele. However, when somebody refers someone with me, I try to get them in.
Sure.
Yeah.
So there's opportunities for new clients.
Yeah, absolutely.
Because that to me that was impressive. Right? I'm all booked up. I do photography also, and I wish my calendar was as full as yours was. So what motivated you to get into this line of work first before you talk about how you wait a minute, where were you before?
I actually moved here in early 2022 from Pennsylvania.
But you're still a Hawkeye fan, right? No, I'm knitting lining kind of. Okay, well, I got to try. There is some paraphernalia here. I'm trying to sell her on the Hawkeyes and how wonderful they are. So what brought you to this area?
Cheap real estate.
Oh, really?
Cheap real estate.
Your husband, I kind of assumed most people that come in, is your husband military or something? No, just I can imagine.
No. Also because it's the Bible Belt.
Sure.
So I figured that people around here would have morals and values and believe in a creator.
Right.
We're like, hey, let's move there.
Right. At least a solid foundation for your belief system, what you bring so that it's not shock and awe.
Right.
That's awesome. Thank you so much. Now, where did you become licensed at?
In Pennsylvania.
Did you have a similar business there?
I had, Yes, I had a massage business there.
Uh-huh.
There were multiple treatment rooms, and
Right.
I had about 5 therapists working for me.
Really?
I did. And when I moved here, I still owned the business, and I just like managed it and owned it from afar for a little while.
Wow.
Yeah.
Well, that's gonna be hard work. That's like a long distance relationship. I can't imagine that.
Well, it was, and like, I couldn't really grow it past the point
Sure.
of like where I left it at the same time. So this year I actually sold it.
Really?
Yeah,
So you can focus 100% here.
absolutely.
Now, as far as capacity within the local driving network, within your network of operations, local populace, are we short of this capacity? Because I'm trying to go off the top of my head, and I've had one massage here, and is there a lot? I haven't even looked.
I don't believe there's a lot of massage therapists.
Right.
There are some excellent therapists around here that I've gotten massages
Right.
from. But there is not a whole lot of massage therapists, so I felt like it would be good to train some up.
Well, that's good. That's good. Not only that, it helps your business, but helps the community out.
Yeah.
Because I just thought about it. If your calendar's full already, that tells me there's a capacity gap, and that it's an opportune time for somebody else to maybe look at this as a good line of work.
Yeah, absolutely.
What's the training or the certification for to be a licensed professional massage therapist?
So in Missouri, you have to have 625 hours of training.
Okay.
Yeah.
Is it all apprenticeship type, or is it classroom, or is it a combination?
It's a combination.
Okay.
Yep.
Okay. And how many? Yeah, we'll get into the person. Let me pop this picture up real quick, so you can talk to it. Now it's the picture. Let me try. This is the one that you can't see right now, but that one. Talk a little bit about that one right here.
Okay, so that's like a general overview of our apprenticeship program. So it says you can work part-time and make a full-time income
Right.
as a massage therapist. So full-time LMTs do about 20 hours of hands-on work.
Right.
So 20 60-minute massages, or like a combination of 60 and 90 minutes, but not more than 20 hours would be full-time. So you might spend about 30 hours a week if you did 20 massages.
Really?
Actually working. Yeah.
That's probably pretty hard work, I can imagine. I mean, it's literally physical work.
It's very physical. Yeah.
What about aromatherapy? Is that inculcated throughout your process, or is that not part of it? Because I know they have the different things and the rocks and the hot steam rocks and stuff. And you see that on cruise ships and stuff.
Yeah. Yeah. That's like spa massage.
Okay.
But I do teach that in the apprenticeship.
Do you really?
Yep.
Wow.
Yep.
And so, how long's the apprenticeship for?
So it's about 8 months.
8 months long.
Yep.
And then out of that, is there a board? Is there a certification or a test?
Yeah, there's it's called the MBLEX test. It's
Right.
a licensing exam, but then they have to submit for licensure with the state of Missouri.
Okay. And how do they demonstrate proficiency in their on-hands training? Is it all book related, or is it do they go in and do something and somebody's checking them
Right. So it's mainly me that's
Okay.
checking them in my program.
while they're going through their apprenticeship? You check the block, say yes, they did this, they completed this facet.
Yeah. And then we do have a portion of clinical hours where
Right.
it's opened up to the public, and the public can book
Oh.
discounted massages with them.
Oh wow.
Yep.
Well, that's interesting. Definitely
Yeah.
got to keep an eye out on that. Now, without having to go through your website and read it to everybody, nobody likes to be read to.
Right.
Me of everybody. Talk about the services that you do offer.
So I myself, I'll offer Swedish massage, which is like general relaxation massage. And in that, there are different enhancement services that I
Sure.
can do, like scalp massage or foot scrub or
Right.
um
I'm ticklish. I just thought about that. I don't think I could do that.
yeah.
And nobody
Well-
wants to touch my feet. Man, that's for me.
Well, maybe you'd be more interested in like table stretching or
sure.
something like that. And then I also offer deep tissue massage, which I have to say is probably my most popular service. Is
Well, I can imagine. I've had that once, and I felt like I just paid somebody $100 to beat the hell out of me. Pardon my French,
pretty much.
but it felt awesome.
Pretty much.
I've had two of them. I had one. I was in a mall in Champaign, Illinois, and I paid for the in-mall therapy, and I felt like I paid this nice little Asian lady $50 just to beat the snot out of me. But that was just me.
I don't think they're licensed.
I don't think they're either. But she beat me up. I was like, I'm not sure I want to do this anymore. You made me.
Yeah. And my main service that I offer is called clinical massage.
Okay. I like the deep tissue sound because I enjoyed that when I had this locally. Can you discuss or highlight any success stories you've had from your clientele that you can talk about, and without divulging any HIPAA stuff, but talk about the results of your work?
Yeah. So about a month ago, I had a client who presented with a muscle strain in her shoulder. She was unable to lift her shoulder up without pain, and she had exacerbated her shoulder more by being in pain like that and like working with it.
Sure.
So after assessing her muscles, I found that it was a muscle strain, but also a compounded muscle strain. So there were multiple muscles that were strained. And then I do a process called scar tissue restructuring.
I can feel the grinding now. I can just hear the gravel in the shoulder.
So scar tissue restructuring, and then I perform a functional movement with them, and then she lifted her arm, and she's like, "Oh, there's no pain."
Really?
Yeah.
That's got to be rewarding.
Yeah, that was incredible.
Now, how does it work? You know, do they come in, or are you coordinating with care providers for supporting treatment after, for instance, pain management? If I go to my care provider and they reach out and coordinate with you, or how does that work? Or does that work? Or is it more likely I just come directly to you?
So you would come directly to me, but I can coordinate with the pain management doctor as well.
Because I would imagine you would like to see, if I got a torn, what's that called? Shoulder muscle. What's it called? Labrum. I tore my shoulder in labrum years ago, and of course you wouldn't have the X-ray, MRI,
right?
But you could coordinate with the doctors. What's wrong going on with your patient, your customer, client, and so you can focus your treatments.
Yeah.
Okay.
Yeah, we could definitely do that.
Yeah. Okay. Now, like anything, we were talking about AI a little bit when we came in here, and how fast technology is moving at the speed of now. I mean, every day it's something new. Do you find it to be similar in your profession of, massage therapy? Is it changing? There's new ideas, new experimentations, is there new results that you share as part of a group?
So there are research studies that we can read, so we're keeping up on our education. I find that the career of massage is really what's changing more.
Really?
Yeah.
Now, do you have certification requirements with professional education requirements, continuing education every year?
Yes. Yep. Missouri requires, I believe it's 12 hours of continuing ed every 2 years.
Okay.
Yep.
And I just assume that it's, opportunity to train up on the latest knowledge, share, learn about it, what's going on in the field, and be able to apply it to your customer base.
So massage therapists will do continuing education in subjects that interest them primarily.
Right. Okay.
So you might have a therapist that wants to specialize in spa modalities, so they'll learn different spa modalities in a continuing ed course.
Layman. What is that?
Like spa modalities, like the foot scrub or scalp massage, hot stones, things like that are more like fluff and buff.
Oh, gotcha. I was just thinking the word modality, and I said
modality. It's also called an adjunct therapy. So like different enhancement services.
Oh, gotcha.
They might learn like Indian head massage.
Right.
I've seen that before. But myself, I've done over 125 hours in medical massage training.
Really?
Yeah.
Wow.
Yeah.
What was it? Did you go to a special school for that?
No, just several different educators that I'd followed or were recommended to me by my educators at school, and I just picked up different like techniques from them throughout.
Now, how long has massage therapy been in part of? It's kind of trivia, but it's just for our audience.
Sure.
How long has it been in existence? Just off the top of the cuff.
Well,
there's probably no right answer because we don't know for sure.
For a long time. A long time.
Yeah, that's a
great.
Well, because I'm thinking, because that America's only been here since what, 1776, and et cetera, but these other countries.
I was going to say the 1800s, but
you think of India and China, they've been doing this stuff for centuries, millennia.
They called them rubbers.
Really?
Back then, yeah.
No kidding.
These were like unskilled massage therapists, and they'd be in like the bathhouses, or like the bath attendants would do massages on people.
Gotcha.
Yeah.
because I was doing my history work before you came in. Massage therapy was gaining traction. I know it's very popular and very receptive, especially as for pain massage. World War I and II, massage was used to rehabilitate injured soldiers.
Yep.
Legitimizing the practice. I'll let the audience read that one. But you have an association of massage therapy. It's like dodgeball. American Massage Therapy Association. Are you a member?
Yes.
Okay.
Yep.
So you got a card? I don't need to see a card.
Yeah, that's AMTA. Yep.
Okay. And that's probably a great source of education and professional development for you to share your lessons and observations and also gain that knowledge rather than trying to figure it out all your own and reinvent the wheel.
Actually, so they have their own continuing ed courses on there, and I use them this go around, and I've done a lot of different like teaching continuing ed courses instead of like the medical massage.
Right.
I figured, well, let me refine my teaching skills.
Oh, we got a question. Ryan Sylvester, what are the price ranges that for your massage services? And thank you so much for your support, Ryan. He was in here the other day. Great guy. Go ahead. You get the question.
So a Swedish massage is 60 minutes is $85. A deep tissue is $95, and a clinical is $105 for 60 minutes.
Do you set up recurrent appointments? If I want to come in monthly, just to unplug and de-stress.
Yeah. So massage is typically recommended once a month,
Right.
and that's for anybody. But where you come in at and like where your body will be different for everybody.
Yeah, exactly. You could not really go in and expect to fix everything at once.
Right.
It's like I'm going to start running tomorrow.
Right.
Not very far, not very fast,
Right.
but it ain't going to fix much. Not that I'm going to, but
Rome wasn't built in a day.
That's right,
You didn't get here overnight.
And you didn't break everything in a day either.
Right.
You didn't break everything. You got to take time to bring it back to pieces. Thank you so much, Ryan.
Thank you.
Let me make sure I got your name. Sherry Fiera. I'm sorry if I murdered that. I do apologize. She is amazing with massages and teaching future therapists. Well, that's kudos to you.
Thank you.
I'm assuming she's a fan and you know her?
Yes.
Did I murder her name?
Ferreira.
That wasn't too bad. Now, new patient, new client, new customer, new friend comes into your house. What's the beginning of it? And I don't know what I want.
Yeah.
And I always heard them deep tissue massage is the place, is what to do. How would you educate me on what may be best for me rather than me going in as a novice and just guessing?
Well, if you had said, well, Marissa, I've never had a massage before, I don't know what to expect, I would ask you what your goal is.
Right.
And if your goal is to have your muscles worked out, then I would recommend a deep tissue. But if you're like, I just really want to relax and just experience massage for the first time, I'd probably just give you a Swedish.
Okay.
Yeah.
Because I can imagine, especially a first-timer coming in there, it's probably intimidating. And one of the opportunities we talked about here is people get to see your face before they know who you are. Wave, say hi.
Hi.
We get a little applause therapy. Yes, thank you so much. Oh, Ryan's got another question. I'll definitely be making an appointment. Awesome sauce. We'll get to the appointments on the website on this one, invitation. The streaming information's on there as well. So thank you so much, Ryan. Yeah, because coming in and not knowing who you are is kind of intimidating. You hear all the the horror stories, and it's kind of like, But so you'd be welcomed in, talk about what your goals are and what they're striving for. That's awesome.
Yeah, I really, like my niche clientele, I want people with complicated conditions primarily, because actually, I haven't met any therapist around here that does niche in clinical massage. So I'm here trying to fix people's problems with their muscles. So
is that where the term clinical massage comes into play as far as the business name? I just never thought about asking for that.
Yeah. My last business, I made a brand name at the top, and then I called it Soft Tissue Therapy.
Right.
And I felt like soft tissue was a little, I don't know, like people didn't really understand that.
Sure.
But I wanted to get away from that word massage.
Sure.
Like the negative connotations of it.
Sure.
However, most people Google massage near me. So I thought this time around I'm going to put massage in my name. And so clinical massage is what I specialize in.
Well, that caught my eye as well. It's not just a quote-unquote fly-by-night truck stop type of deal. It's it's legitimate, and it's the pursuit of enabling people to recover and to heal.
Yeah, that pursuit of well-being. Yeah.
Got another comment. I definitely recommend Marissa. I've seen her once a month, and I wish I could go more often. So nice. Thank you so much. That's Karen Crawford, Schumer Crawford. Thank you so much.
Thank you.
Now, client feedback. Other than hearing the snap, crackle, pop, I said, I watch too many chiropractor videos, but I got stupid amounts of this useless movie information in my head. So every time I think about it, massage therapy snipping in a movie, bend, snap, crackle, pop. Mm-hmm. But how do you incorporate feedback from a new client? For instance, sometimes they don't know how to answer back, but you kind of coach them. How you get that feedback from them?
So, like a general question I'll say is like, how does the pressure feel?
Right.
And they'll go, fine.
Yes. Sure. I'm not screaming.
And I'm like, would you like more or less pressure? So I try to like narrow down the question so that, if they're like, well, you could do a little bit more there. And then they'll be like, okay, too much.
Is that when the elbow comes in? Because that's when you're doing that.
Sometimes.
That elbow's powerful.
Yeah, so I'll just like hone in those questions, and really try to get it out of them. Like if they don't think I'm giving them enough pressure, I'm going to give them more pressure, maybe drop my table a little bit lower and lean an elbow in. But if I'm giving them too much pressure, I can certainly lighten up too.
Do you know who Macho Man Randy Savage is?
No.
WWF wrestler. He'd come off the top turnbuckle with the elbow. You want pressure? I'll give you. It ain't like that. But I'm sorry. That's the first thing that came in my head.
That's okay.
That's all right. What role do you see your clinic playing in the wider community, especially with pain wellness, treatment, management techniques, and not only that, but education? You have thousands of veterans suffering each and every day. How do you hope that your niche will work to better enable them to help to treat them, fill that capacity gap that we have, it seems to have here?
Yeah, I've actually seen a lot of veterans since I've moved here. And my first year here, I thought that maybe that's what God wanted me to do, was to work with the veterans, and which would have been a fine answer as well.
Sure.
I like working with the veterans. I don't have as much availability as I would like to work with all the veterans.
Thus the apprenticeship program.
So, and it was great. My apprentices told me the other day, like even though I don't have a large business with multiple treatment rooms and multiple therapists anymore, that I'm having a greater impact because I'm educating other people now to do massage therapy, and then all those people will get to work on their clients in their respective areas and make a difference in their communities.
Well, it's increasing the capacity for the healing treatment, the services. That that's something that can't be understated.
Yeah,
or can't be overstated, I should say.
Yeah.
Payment options. Well, let me go back. Payment options. Is it insurance? Does insurance cover it? Not yet.
No.
Not yet.
No. VA can cover massage therapy, but I don't accept VA insurance at this time.
The VA stuff?
Yeah.
Okay, gotcha. I got 3 questions for insurance, so obviously I got to go back and check those out.
That's okay.
Let's see if we got any more questions. If you got questions, I got the phone line open. It's at the bottom of the screen, 573-408-0339. If you got a question for Marissa, you'd like to comment, make a comment about or observation about her services. Now, when you get a new client, what's the process for developing that long-term plan? We talked about recurring, but what's the process for doing that? Because you're fully booked up, so your time is obviously precious, and you have to manage it carefully. But to really get into the needs of a client, how do you build that plan?
Well, if they have like a chronic pain problem or something that needs continuous sessions to address, I'll definitely tell them that and saying like, hey, I'd recommend you come back in about 2 weeks so that we can get ahead of the pain rather than like just, warding it off. Or, a lot of people will think it's a one and done kind of thing. But this is like you don't just get one oil change ever for your car.
That's so true.
So you would definitely want to keep going back. So that it's called muscle maintenance.
Right.
Yeah.
For a reason, it keeps going on.
Yep.
I'm going to see if I can populate my little sponsor tab. So stay tuned for an ad about one of my great sponsors. Let's see if it works. There it goes.
than the Pru Law Office. Our experienced attorneys specialize in family law, criminal defense, and personal injury cases. We are dedicated to providing personalized and compassionate representation to our clients. Located on the square in Waynesville, just across the street from the courthouse, call us today at 573-774-6444 or by email at prulaw@aol.com for a free consultation. Pru Law Office, your trusted legal partner in Waynesville.
And we're back live. So we got the phone lines open, ready for your questions. It's listening in, home, far, near, wherever. That's also available on YouTube if you're favorite. And I actually got a TikTok account, but because I use MacBook, they don't like live feeding into TikTok for some reason. So whatever the reason is. So if you got a question, call in. If not, what would you like people to know about you that we haven't talked about today?
Well, because it sounds like I don't have a lot of availability, I
Sure.
just want to put out there that my apprentices will be taking appointments beginning
I seen that on your
October
website.
14th,
I seen that.
and their apprenticeship program ends December 18th. So once I've finished teaching them, I will have more availability for new clients beginning in January.
Gotcha. And they can book on your website, which is included in the description for the show.
Yeah, they can book on my website. And like, if you're somebody sitting there and you're saying, oh, I'm really in pain, I could really, she'd be a great massage
Sure.
therapist for me, like, please message Olive Branch's Facebook page and I will do my very best to get you in sooner.
What's your best method of communication if they want to reach you? Is it Facebook Messenger?
Yeah, Facebook Messenger on Olive Branch's page.
Okay.
Because sometimes I'll have people call Olive Branch's phone line and they
Right.
don't leave a message, so I
Sure.
don't call back.
Sure. And all you see is a missed call and you don't like to
Could be
intrusive.
spam.
Yeah, it could be. Yeah.
Right.
I don't answer the phone. I really don't.
Right.
Well, with that, I think we're about to wrap it up. First time show, but I welcome you back at any time you want to talk about. Bring your apprentices in. We can talk and have them talk about. I think that'd be awesome. We talk about the benefits of massage therapy, what they've learned,
Sure.
and then maybe serve as a recruitment tool to bring some more apprentices on and increase that capability and capacity within the community. So
That'd be great.
subject to anybody's questions coming along, we're going to go shut down the show. And thank you, Marissa, so much for coming with us today.
Thank you.
I
for
really
having me.
appreciate it, and we enjoyed having you here. And with that, we're going to shut the show down. Well, thank you, everybody, for watching. Stay tuned, and be sure to like, follow, and share. Coming up on 1 October, we will be broadcasting live from Crocker, Missouri's Amazing Grace Fellowship, the town hall session for the local elections and nationwide elections. So we plan to be there broadcasting, as well as the next one. I believe it's on 8 October at the St. Robert Community Center. You expect to see us there. You can sit down with us, ask some questions, talk about some politics, get fired up, get really